Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm speaking with Sean Carroll, the CEO at Arcadia. Sean, how are you today?
I'm doing great, Jared. Thanks for having me. And how are you doing?
I'm doing all right. It's been a crazy year, right? But super excited to chat with you. I know we've been trying to put this on the books for a little while now, so it's great to be able to have the opportunity to chat. We can dive right into it. I'd really appreciate, and I know the audience would as well, if you can tell us kind of a quick snippet of your background, and then we'll kind of talk more about Arcadia.
Yeah, happy to do it. I'm what most would call a professional healthcare lifer. I've been in healthcare for approaching now 35 years, and mostly on the provider side of the marketplace. And mostly around data across 6 different businesses, from startups, self-funded startups, through publicly traded companies, really trying to advance healthcare through information in both service companies, software and data companies, and companies that were kind of hybrids of both. Very excited about Arcadia, though. Probably the best mission I've been involved with.
And that leads me into my next question, Sean. It's something I ask every guest that comes on the podcast. If you can quickly give us the why, how, what of Arcadia, that'd be much appreciated.
Yeah, so, we're fortunate to be really universally dedicated to the sort of collective mission that we're on. And it starts really with transforming healthcare to be value-centric, essentially by being a pioneer supporting pioneers. And that's really a phrase that we coined several years ago, and sort of established the position and mentality of the business to be on the front edge of those organizations who are dedicated to moving healthcare to a different and better place. And that's been our focus, both from a market perspective and customer pursuit perspective. It's done well for us, and it's quite rewarding. Secondly, we're really dedicated to this concept of whole person care, this future reality where there's a collaboration between all those types of organizations that support the front lines of healthcare to build a higher quality of life for everybody. And then I think thirdly, really to be a steward of the concept of trust in healthcare data and technology, which we believe is the key to transformation or change at pace. And that's really important as well. We have to move this along from our perspective, so we want to make sure we do our part. That's really the why. That's why we get up every day. I would say the how is, we at scale, we aggregate population level data from numerous sources, clinical, EHRs, for example, payer data, administrative data, SDOH, publicly available data, and we curate that data on an ongoing basis. We compile that into a unified patient record, and then we provide a comprehensive set of software on what we believe to be healthcare's most trusted data platform, so customers can improve outcomes and lower costs, and in the process help that transformation along. And then, sort of maybe sub to that, but to put it in more tactical terms, really getting the right actionable data to the right place at the right time is the way to think about our outcome to the process. And that's from CEOs and other leaders who are looking at current value-based contracts, or thinking about moving into risk, and helping all that entire process, all the way down to providers at the point of care, when they need to make decisions, and everyone in between. And so it's a very comprehensive approach to this concept of data and software on healthcare's most trusted data platform to accomplish all that.
Right, and if it's okay with you, Sean, and thank you for that intro and being able to kind of dive more into Arcadia. We really appreciate it.
Sure.
I'd like to shift focus a little bit in terms of impact. And when we first started the podcast, I mentioned, it's been a crazy year, right? It's been a crazy last 2 years. Can we talk a little bit about how like some of your customers were basically initially impacted from the pandemic, from COVID-19?
Yeah, it's as you might expect. There's a range, everything from, we had some customers who literally just couldn't make it through and had to close up shop, so to speak. There wasn't too many of those. A very small number. To those who actually thrived, and as you might guess, those that thrived were more deeply engaged in value-based care initiatives, which for many of those organizations really carried entire health systems along through that very difficult time for hospitals and fee-for-service type driven entities. So we had a wide gambit, and then those that were in the middle, and we as an organization, did many things for that, but we did everything we could as creatively as we could to help everyone in every situation. As our mission immediately changed to how do we just assist these pioneering organizations in this dire moment, and it became more of what can we do, how can we help, was kind of the essence of every phone call or video conference.
So I know you talked a little bit about this, but can you tell us what are some of the things that Arcadia did to kind of spring into action to help your customers?
Well, I think we sat down quickly, and I mean very quickly, and we thought about the different ways that we could assist, and we kind of broke it down into a few different categories. How can we assist with our vast data asset? We have 170 million patients in our database, essentially a third of the country. How can we assist from a public health and education point of view? What can we learn? What do we know? How can we help at that level? For our customers, more specifically, how can we look at their patients on their behalf and identify high risk in patients based on other factors about the patient, identify them for the provider customer, and affect outreach in a prompt way to those patients to help educate, prompt them what to do, what not to do, when to call, when not to call in. These are the early days of COVID, of course. Look at the entire essence of medical vulnerabilities, and help our provider organizations understand patients in that regard. Same with mental health, and then gather and analyze data on behalf of them with respect to what we're seeing as our clinical data refreshes every night. And so it's quite dynamic. what are we seeing with patients who do have COVID and what's happening with them. And so we launched a rapid development cycle to where we could build a set of tools and strategies that would support those sort of categorical areas of focus. And as an example, we sent out millions of on behalf of our provider customers. We sent out millions of outreach texts, and that resulted at the right time, obviously not in a rush because that wasn't the right answer in the early days, but over time that resulted in 23% of the recipients eventually getting to a visit. And so we were able to help them manage their population in a different way than we normally do with our tools in a very focused and critical moment. And they were very grateful, to say the least. It was quite effective in the moment. We learned quite a bit about ourselves in that moment in terms of what we're capable of under duress, as I think the pandemic taught all of us in one way or another. Absolutely,
yeah. And you, what's great is you answered one of the things I was going to bring up to you when you were talking about basically the different points of data that you have and what you're using it for and how you're helping your customers basically target the right patients with that information. You went into a couple other things too, which is perfect. It's always great if I don't have to ask something and you're giving us that perfect explanation. It's not about me, right? It's all about pointing the spotlight on you and your organization and what you're doing in the industry.
Hey, Jared, everyone gets lucky every once in a while, so I'm glad I guessed right.
Absolutely. I have one last question for you before we kind of wrap things up. We like to keep these short and sweet for our audience. But as it relates to the future of data, so what do you see as the future of data and analytics in the healthcare industry, basically as it relates to population health management and beyond? Yeah,
well, first of all, I think if you're not data driven, data centric, you really have no shot almost in any industry or business anymore. I think that analytics will become the underpinning of how decisions get made in the moment and strategically. I think that if we really envision a new healthcare system, a new approach to healthcare, then it will come from data and the analysis of that data. And it's really the only way that we can get to a future state where the healthcare experience, which will be in the patient's or the individual's hands more and more and more, will be able to manage with confidence their own healthcare in partnership with their network of caregivers. And I also think there's a reality too, and it's in many ways data and the analytics of that data is the pathway to lowering costs, improved quality of care and outcomes. I think it's also the medicine, if you will, that eventually will help evolve the healthcare, the business of healthcare, to a place where the amazing humans that operate within healthcare on the front lines, the caregivers, everyone who's part of providing healthcare, to get them in a better place, which they so richly deserve for their dedication. And I think all of that is foundationally driven by transformation, which is foundationally driven by the analytics of data as real time and as comprehensively as possible.
And my last, I know that I said that was the last question, but I do have one more question.
Okay.
What's next for Arcadia? What do you see next? You can either answer what's next or what are you most excited about?
Well, I'm maybe a little bit of both. I'm very excited about what the question you just asked, and what it purveys around analytics and the dedication that I see in the marketplace to data, into tools to make data useful, usable, actionable. I'm excited about that notion and the broad dedication to that concept across those who support the healthcare system in general. I think we need, we just need more power behind all of these initiatives. We need more and better data. We need more really smart innovators. We need disruptors. We need better artificial intelligence. All the things that we're doing. Really, we need so much more of it to move the needle at all and to move it faster. I'm really excited about, what I hope will be more and more involvement from the government on incentives to evolve and change. And I think that's critical. We're coin operated here in this country, and incentives are what change things. So I'm excited. I'm a little frustrated. That's not moving faster, but I'm excited to see new things happening in that regard too. And for us, I think, when that first why question, we really want to see the emergence of a value-centric environment, this whole person care reality and healthcare data and technology really being trusted, which is so critical. And I think if that happens, and we dedicate to all those things, and I think we will achieve some of the things I just mentioned a minute ago around serving the great people in healthcare, and allowing us all as patients and really future generations. From my perspective, that's what I'm working hard for, is some future generation and those to follow, to really be proud and confident in our healthcare system.
Well, Sean, I'm really excited that really glad that you were able to come on the podcast today. Hopefully we can have you come on again in the near future. This is just your first episode on the podcast with us, so we really focused on an intro. We asked you some initial questions, but hopefully we can have you on again soon and we can talk about some other issues.
Love to do it, Jared. Thanks for having me.
Thank you.